Good afternoon or good morning to you, depending on where you are in the country. My name is Jose Leon. I am the Chief Medical Officer for the National Center for Health and Public Housing. Thank you so much for attending this learning collaborative, The Road to Health, How to Prevent or Delay Type 2 Diabetes in Your Community. This is a training that was created by the National Institute of Diabetes, Digestive and Kidney Diseases, NIDDK, in collaboration with the Centers for Disease Control and Prevention. We are going to go over the training. If you go to your chat box, you will find two documents. One is the flip chart that is used for this particular training, and some activities. This is another document, activities guide, which if you are with member of your community and you want to have an engaging communication or engaging conversation with them about diabetes, you can use this particular document. It has many ideas, and we are very pleased to just guide you through all this training. And we have somehow modified the training just to make it more interactive. Please, if this is an interactive session, if you have any questions, if you would like to participate, either you can do it both ways, either type in your question or asking a question verbally. So next slide, please. So before we get started, we have some housekeeping items. At this moment, all lines are muted. If you have any questions, if you have any comments, if you have any promising practice that you would like to share, you can either use the chat or you can use the raise hand icon, and we are going to unmute your line. This meeting is being recorded, and all the materials will be sent to all participants in the next few days via email. So next slide, please.
And Dr. Leon, before we move on, I just wanted to quickly ask everybody if you could provide a brief introduction of yourself with your name, the name of your organization, and also what is your title, and you can provide that information in the chat. Thank you so much.
Thank you, Fide.
Yes.
So today I will be leading this conversation, and Fide will be helping me with all these questions, as she's been with the National Center for many years. She is a health educator with ample experience dealing and having conversation with patients as well. So it's going to be our pleasure to be part of this conversation, to have Fide as part of this conversation. Again, my name is Jose Leon, and I'm the Chief Medical Officer for the National Center for Health and Public Housing. Fide, please introduce yourself.
Yes, thank you so much, Dr. Leon. So hello, everyone, and it is a pleasure for me to join this presentation today. My name is Fide Pineda Sandoval, and I am a certified health education specialist as well. And I'm also the Training and Technical Assistance Manager here at NCHPH. And then today, I hope that you guys enjoy the training and all the information that we will be providing to you all.
Thank you, Fide. Next slide.
All right, so this is just some information about the National Center for Health and Public Housing. The mission of NCHPH is to strengthen the capacity of public housing primary care health centers and other health center grantees by providing training and a range of technical assistance. NCHPH is also supported by HRSA, and is also a national training and technical assistance partner. It is 100% financed by this grant. And the information or content and conclusions are those of the author only and should not be construed as the official position or policy or endorsements inferred by HRSA.
Thank you, Fide. Just a brief introduction about the National Center for Health and Public Housing and the health centers located in or immediately accessible to public housing. This is the most recent use data, and in 2021, over 1,300 of community health centers reported to serve about 30 million patients.
Sorry, Dr. Leon, may I ask everybody to please mute your line? I can hear some background information, background noise. Thank you so much. Thank you, Dr.
So 458 of these health centers reported to be in or immediately accessible to public housing, and they serve over 5.7 million patients. 108 of these 458 health centers are public housing primary care grantees. They receive PHPC funding from HRSA to provide services to public housing residents. And they serve over 900,000 patients in 2021. On your right-hand side, you can see the maps, the locations of the health centers. And if you visit our website, www.nchph.org, you can find this map and other maps showing the location of the clinical sites of all health centers in the United States and the location of the public housing developments. So this is a very interactive map. If you think that you are close to or immediately accessible to public housing, you can access this tool at www.nchph.org. Next slide, please. Public housing is a very interesting population, specifically because within public housing, you have some vulnerable populations that require our attention. 19% of the household reported to have at least someone who is over the age of 65. And the 36% of the household also reported to have children under the age of 17. It's really important to mention that there is a large percentage of those living in public housing are from ethnic and minority groups. 43% are African American, and 26% are Latinx. And so these numbers are extremely important when you are going to provide services to this population. Also, I always highlight that 38% of the household reported to have at least one person with a disability. Is important. All these services that you provide, how if there are some transportation issues, you have people with disabilities, people over the age of 65. There is a lot of health literacy issues. So it's important to know the demographics of your population when you are serving public housing residents. Next slide, please. So this learning collaborative has 3 objectives. We are going to learn about the CDC's Road to Health training for CHWs. As I mentioned, this is an effort of the Centers for Disease Control and Prevention and the National Institute for Diabetes, Digestive, and Kidney Diseases, NIDDK. Our second objective is to discuss strategies to prevent type 2 diabetes in your community. And the third objective is identify practices on how to help members of your community to be physically active. Today, we are going to discuss the CDC's Road to Health training for CHWs. We are going to provide some basics or some basic information on type 2 diabetes. And we are going to briefly introduce something about healthy eating. So that's what we're going to do today. Next slide, please. So these are the learning objectives as well. We are also going to discuss how diabetes affects various organs of the human body, some diabetes risk factors, and how to use your hands to measure portion sizes. Next slide, please. So before we get into the content of this particular toolkit, we are going to have an interactive activity. It's going to be whether or not you believe this is a myth or a fact. So Fide, take it away.
Yes, thank you so much, Dr. Neon. So right now I'm just gonna go ahead and put some questions on the screen. And if you can provide your responses, and then we're gonna go over the answers. So for the first question, we have prediabetes can lead to type 2 diabetes, but it's reversible. Do you believe this is a myth or a fact?
Please use the chat box You know, I mean, this is just to measure where we are, what we know about diabetes. So if you think that pre-diabetes can lead to type 2 diabetes, you can say that this is a fact. Or if you think that this is not right, you can say that this is a myth. So thank you, Carrie. If Carrie says that this is a fact.
Yep. And then also based on the results, Dr. Neon, majority of respondents said that it is a fact. And that is the correct answer. Prediabetes can lead to the development of type 2 diabetes. And fortunately, prediabetes can be reversed through healthy eating and increased physical activity. So next we have our second question. Does prediabetes is not a real clinical condition?
Thank you, Maria. Maria says this is a myth. Brenda and Carrie say this is a myth. And Joan also says this is a myth. Fide?
Yep, that is the correct answer. And prediabetes is a medical condition that can be diagnosed by a doctor and also means that your blood sugar is higher than normal, but not high enough to be considered type 2 diabetes. If you have prediabetes, you can take small steps to lower your blood sugar and avoid developing type 2 diabetes as well. All right, now we're gonna go on to question 3. The only diet for people at risk for type 2 diabetes is avoid eating red meat, carbs, or added sugar.
Carrie says that this is false or a myth. Maria also says that this is a myth. Yuan's response is a myth. So Fide, what is the right answer?
Yeah. So the right answer is that it is a myth. Reducing your risk for type 2 diabetes doesn't mean giving up all your favorite foods. Preventing type 2 diabetes means making personal lifestyle changes that work for you. And also lifestyle changes is made up of small choices that contribute to a healthier life, and it's not a drastic change or a fad diet. And lastly, we have our last question on if you have family members with diabetes, you will definitely get it too.
So we have 3 responses today. Maria, Carrie, and Yvonne are saying that this is a myth.
Yep, and that is the correct answer. This is a myth. While your family history can increase your likelihood of type 2 diabetes, it can still be delayed or prevented with lifestyle change, such as small changes to your diet and physical activity.
Thank you, Fide. Next slide. So before we get into the basics of the type 2 diabetes and pre-diabetes and everything that is related to this particular training, I just need to remind you, and if you have just joined us, that there is in the chat box, there are 2 documents that you can download. There is a flip chart that you can use when you're having conversation with your patients. And there is also a guide of activities. Since this is a very interactive training module developed by NIDDK, that's the Center for Disease Control and Prevention, you can use this document, you can print them out, and or you can just read them and use them when you have contact and when you're discussing diabetes with your patients. So just a very brief introduction about pre-diabetes. And we are going to measure, we are going to mention some numbers, but in general, when someone has prediabetes or is diagnosed with prediabetes, what it means is that this patient has blood sugar levels that are higher than normal, but aren't high enough to be diabetes. Next slide, please. So what is diabetes? Diabetes is when you have blood sugar levels that are higher than normal. And there are three types of diabetes. We have type 2, type 1 diabetes, type 2 diabetes, and the third one is gestational diabetes. For this particular training, we are going to focus specifically on type 2 diabetes. And this is going to be the main concern for all of those patients that you are taking care of, specifically in public housing, which is the area where we focused and we specialized. 32% of the patients with diabetes in public housing have an A1C greater than 9, which is considered uncontrolled diabetes. So if we look at the next slide, please. We have what we consider prediabetes, diabetes, and depending on the type of blood work or blood test that we use. For A1C, if the result is between 5.7% and 6.5 or lower than 6.5, that is considered diabetes. If it's over 6.5, that is considered diabetes. For the other test, the FPG, if the result is between 100 milligrams per deciliter to less than 126, that is considered prediabetes, and over 126 is considered diabetes, and the OGTT is between 140 and less than 200, that is prediabetes, and any result over 200 milligrams per deciliter, that is diabetes. Next slide, please. So we are going to have an interactive quiz. This is something that you can find in the document that I was mentioning. If you go to the activities guide, you will find this document. Also, there are a PDF document that we are going to share with you when we have our next session, that it will have several of these examples. But one of the main concerns when we talk about diabetes is how, the portions and the have increased, in the last 20 years. For instance, in 20 years ago, coffee, 8 ounces of coffee only had 45 calories. But now, if we go to any of these places, and really nice places where we can get coffee, not going to advertise any, but if you get a mocha coffee, how many calories, and this is just an estimate, how many calories do you think that you can get on a mocha coffee with syrup? Just look at your left-hand side, you will see that 1 cup of coffee with a whole milk has 45. How many do you think there is in a mocha coffee? We're looking at some responses already: 220, 90 calories, 120, 220, over 200. Yeah, I mean, there is a huge increase in the number of calories. The right number is, see the next slide, please.
Yep.
That there are 350 calories. So that's the difference. And one of the main concerns and challenges when we discuss how to eat healthy with our patients. So the difference between the two is 305 calories. So our next question is, next slide, please. How long will you have to walk in order to burn those extra 305 calories? This is a question. We are eating more, and what we eat is equal to the number of calories that we are going to spend. So what if we walk, if we have this coffee? So how many miles, or do you think, or oh, I'm sorry, the amount of time that you think that we have to walk, 45 minutes, we will have in an hour, 3 miles. Fide, next slide.
Yep.
So is an hour and 20 minutes for someone who is about 130 pounds to burn 305 calories. So what is the issue? The issue is that not everybody has 1 hour and 20 minutes to spend to exercise. So there has to be a balance between what we eat and the number of calories that we burn every day, because we have all people working hard trying to make sure that you have everything that you need. You have to complete your daily activities. So please keep in mind when you talk to your patients about this coffee and this amount of calories that they need to burn in order to burn all these calories. And next slide, please.
Mhm.
So we've been talking about diabetes, pre-diabetes, and sometimes we don't know exactly what is happening. We need to keep in mind that when we talk about sugar, that or carbohydrates or glucose, that is the main source of energy for our body. And we start ingesting these calories, and these are absorbed by our small intestine, and the glucose goes into the cells through different processes. But this is a really nice video that you can use with your and show to your patients, so they have a really better understanding what is happening inside of us. Because we're talking about diabetes, pre-diabetes, and there is a confusion with the terminology that we use. But honestly, this video explains clearly what is happening. So if you can play the video, please.
Understanding type 2 diabetes. Type 2 diabetes is a metabolic disorder that causes sugar in the form of glucose to accumulate in the blood rather than being used as fuel by the cells in our body. When we eat, food is broken down by our digestive system into nutrient molecules that are then absorbed through our digestive tract for use by the body. Foods containing carbohydrates or various sugars are broken down into glucose. Glucose is an important source of fuel for many organs in our body. However, to be able to use the glucose for fuel, the glucose molecule must first enter into the cell. The pancreas produces a hormone called insulin, a chemical messenger essential for the entry of glucose into cells. As the blood glucose levels rise after a meal, insulin is released into the bloodstream and sets processes in motion to trigger the removal of glucose from the blood to enter into the cells. In type 2 diabetes, the cells become resistant to insulin and ignore its message to absorb glucose. This is known as insulin resistance. In addition, in type 2 diabetes, the pancreas is unable to produce the greater amounts of insulin needed to trigger these resistant cells to take in glucose from the bloodstream. The most notable symptom of diabetes is frequent urination and excessive thirst. Other symptoms include weakness, drowsiness, and blurred vision. These are caused by chemical imbalances in the blood related to high levels of blood glucose. About 1 in 4 people with type 2 diabetes are unaware that they have the disease. It is important to catch diabetes early. Over time, high blood glucose damages the blood vessels, which can damage the organs that these vessels supply, leading to a variety of health complications. Damage to the small or micro blood vessels can cause vision problems, including loss of sight, nerve damage, and kidney disease. Damage to larger or macro blood vessels can lead to cardiovascular complications such as heart disease, stroke, and poor blood circulation. Overweight and inactivity are major causes of diabetes. A family history of diabetes significantly increases your risk of developing the disease. Certain ethnic populations are also at increased risk of developing type 2 diabetes. Finally, some medications may increase your diabetes risk, specifically corticosteroids, thiazide diuretics, drugs used to treat certain mental illnesses, and some antiretrovirals used to treat HIV infection. In summary, type 2 diabetes is a metabolic disorder. It causes sugar in the form of glucose to accumulate in the blood rather than being used as fuel for the cells in our body. If not diagnosed and treated in a timely manner, type 2 diabetes can lead to many health complications.
Thank you so much, Fide. Yes, we are going to send the link and the resources and the materials to all participants in the next few days after this first session. Carrie, so you are going to get the link for this video. So there are several ways that we can do how we prevent type 2 diabetes. We have already discussed the number of calories in some of the drinks and foods that we consume every day. We just discussed the mocha coffee versus the coffee 20 years ago and how long it takes for our body to burn those extra calories. So there are two ways to prevent or delay the onset of diabetes. One is to eat healthy. That's one of the issues that we are going to address in the next few sessions. And the other one is to exercise. We discussed, okay, we have like 1 hour and 20 minutes for someone to burn over the 205 calories. Do we have enough time? Do our patients have enough time? There are some recommendations from different federal agencies about the amount of time that we need to exercise. There are several places where we can find this information. The Center for Disease Control and Prevention recommends 45 minutes, at least 5 days a week. We can also review some recommendations from myplate.gov in regards to portion sizes and the type of food that we have to eat in order to keep our weight and try to at least delay type 2 diabetes. So this particular training and this particular document, our toolkit, has all that information. Again, is on the chat box. If you cannot find it, just let us know. Fide can resend the link again. So next slide, please. So there are several ways, right? And there are several challenges as well. When we talk to our patients, we need to consider their ethnicity, for instance, the type of food that they eat, whether or not they have a place where they can go and exercise. Some places are not secure enough for people to exercise outdoors. Some health centers offer indoor exercise programs for patients, as well as some food pantries and other really nice evidence-based practices, just to make sure that people eat healthy and exercise. As you can see on this slide, we have people trying to cook healthy, to seniors exercising, making sure that we address the be respectful of the ethnicity and the type of food that our patients eat every day. That's something that we can discuss later. as well as how we can increase the number of vegetables and the number of healthy food in our diet. Next slide. So the whole training is going to focus on two people. They are sister and brother, respectively. One is Angela. She's 20 years of age. She's an elementary school teacher. And Ray is 32 years old. He's a realtor. And one of the main problems with them is what we have already discussed, and I'm going to stop for a moment and ask you, the video that we just saw had some information about what are considered some diabetes risk factors, and it mentioned a few of them. So I would like to ask, and for this one, you can also use the chat box. If you had to mention to your patient some non-modifiable risk factors for type 2 diabetes, what would you say to these patients? Okay, there are some risk that factors that you can modify. There are others that regardless of what you do, you won't be able to change it. So what are those who you think that you cannot change? Here it says genetics.
Genetics, yeah.
And that's correct. Family history or genetics is one of the factors that increase the risk of diabetes. Either if they are parents or close biological relatives. So if someone, or if you have a patient, a blood relative with diabetes, your risk of developing the diabetes is significantly increased. So that's something that we cannot change. So this is a risk factor. I totally agree. Is there any other that you have in mind that is a non-modifiable risk factor, something that we cannot change?
We have a response also from Joanne saying family history could be
Correct.
applicable as well to genetics.
Anything else that you guys believe or you have to say to your patients, so your patients are aware that there are a couple of things that you can change and there are a few things that you cannot change, and we need to focus on the things or the factors that we can change. So there are others, race or ethnic background is another risk factor. There have been some research on this particular issue, and minorities in general are more likely to develop diabetes. We were talking about African Americans, Latinos. We are talking about Asian Americans, and the other minorities living in the United States. They are more likely to develop the type 2 diabetes. The other one is age. As we age, what is happening is that sometimes the pancreas is not releasing the amount of insulin that we need, that there are other pre-existing conditions, as is mentioned in the chat box. Yvonne is right when she says that there are some pre-existing conditions, that they, when we are aging, we have other chronic conditions that are affecting. And if you have these chronic medical conditions, you are more likely to develop diabetes. And the other one that is mentioned, probably we don't have it in mind, but is gestational diabetes. When someone is pregnant, this pregnant can develop diabetes, and this person who develops diabetes while or during pregnancy, this person is more likely to develop type 2 diabetes. And so in regards to modifiable risk factors, my question now is, you have a patient, the patient may have some family history of diabetes. It can be part of any of the racial or ethnic minorities. The patient is over the age of 50, 55. So this patient cannot change those. But what would you recommend? You know, okay, you can't do this, or you can't modify these factors, but you know, if you do this, you will be more likely to a delay, you know, or not develop diabetes. Yes, so Maria and Denise are right, and Francis as well. Weight and physical activity are two that we can modify, and we are going to focus a lot on physical activity and how to eat healthy, as well as other chronic medical conditions that were mentioned in the very beginning. People who have hypertension or high blood pressure, or the cholesterol levels are high, or if they smoke. There are a large number of research studies showing that people who are current smokers are more likely to develop diabetes. Alcohol consumption and stress and sleep. These are two really important issues, because in our society, we have many people have been affected by behavioral health issues. Specifically, we have anxiety disorders, or people who are not sleeping enough. So these are things that we can help our patients and let them know that they can modify these factors, and therefore they can avoid or reduce the risk of diabetes. Next slide, please. When we have diabetes, there are two main things happening in our body. One is that sugar usually affects the blood and the blood vessels, and also the nerves. So because of that, the main complications for someone who has diabetes are these people can develop stroke, they can get blind, if they have to see a doctor, an eye doctor every year, just to make sure that they don't have any issue with their eyes. Heart disease is another condition, and they can develop some myocardial infarction, kidney diseases. And because of both complications, I'm talking specifically about the vessels, the damage of the blood vessels and the neuropathy, some people get amputations of the lower limbs, and that is one of the main concerns when you have diabetes. And the main cause of amputations in the United States is type 2 diabetes. So let's keep that in mind. Let's going back to our to our brother and sister, and she is asking how diabetes can affect her body. You can use this. And again, this is part of the training. This you can find this in the as part of the or in the flat on the toolkit that we have. So making sure that we address these kind of questions. Somebody was asking whether or not they have family history. Yes, if you go back to the document, the document is more explicit about the modifiable factors. They have family history of diabetes. Because of their activities, they are not eating well. One is a teacher, the other one is a realtor. So those are the family history and the background information that we need to know. Next slide, please. This is another resource that I would like to use. You can use this chart. Again, you are going to have access to this slide deck, and you can see whether or not a person that you are talking to is either overweight or obese or extremely obese. You can also, if this person has access to the internet, and if you type, weight calculator, it will take you to a Centers for Disease Control and Prevention calculator, and the only thing that you have to add is your height your body weight, and it's gonna give you, based on the information that you are given to this calculator or to this system, whether or not you are either obese, overweight, or you are in the normal range. Next slide. Again, another resource. If someone is overweight or is obese and this person is 150 pounds, this person needs to lose, based on the latest American diabetes recommendation, 5 to 7% of their weight. So it's about 7 to 10 pounds. And you can go over all these just to calculate the amount of weight that they need to lose. But for someone who is over or around 300 pounds, this person needs to lose at least between 15 to 21 pounds. Next slide. So what we're getting from one of the members of this family is that diabetes runs in their family, but I don't claim it. I'm making small changes to what I eat and do. I'm losing a few pounds and I am in control. So that is exactly what we have to explain to our patients, that we need to eat healthy, that we need to make sure that we exercise. We are going to keep giving all this information. We are going to discuss about, we're going to be discussing briefly in the next few minutes, some portion sizes, as well as next week, we are going to talk about some exercises that we can recommend to our patients. Next slide, please. So this is another video. Sometimes the main issue is the portion sizes. We know and we saw that it's not the same to have 4 ounces of coffee than 12 or 16 ounces of coffee. And it's not the same to serve the coffee with whole milk than with mocha syrup. So let's see this video, which I also consider really important to show to our patients and how they can measure portion sizes by using their hands. Next slide, please. I'm sorry, play the video, please.
Did you know your hand is a powerful tool to help you from overeating? All you need is right here. I am Susan Wright, registered dietitian at CHI Health. Looking to butter your toast? A portion of butter or oil or meal is about 1 teaspoon, or about the size of the tip of your finger. Your thumb is about 1 tablespoon. The next time you're eating salad dressing, peanut butter, cream cheese, let your thumb be your guide. Wanting a snack? A serving of chips, crackers, pretzels, ice cream, and even pasta are about 1 cupped hand. A portion of meat is about 3 ounces, which is about a half a chicken breast or the size of the palm of your hand. If you make a fist, that equals about 1 cup or a serving of cereal, soup, fruit, or casserole. So the next time you dine in or eat out, take a look at your plate and take a look at your hand and get a handle on how much you're really eating. This update brought to you by CHI Health.
Thank you, Fide. And Francis, I totally agree with you. Sometimes the patient lose weight because of diabetes. It's true. If we go back to the very first video that we play, the video explaining how insulin is like a key to open the cells so glucose can get into cells. What is happening is that if by any reason we have insulin resistance or the pancreas is not producing enough insulin, all these nutrients are just circulating in our body, but they are not being absorbed by our cells or organs or tissues. So what is happening is that the cells are not receiving the nutrients that they need, and therefore patients start to lose weight. Why? Because all these are eliminated when we urinate, and when we have diabetes, we are just releasing from our body many of the nutrients that could have been absorbed by the body, but they were not, because we have either insulin resistance or we are not producing enough insulin. You're totally right. Now, in regards to visualizing portion sizes, this is another good resource that you can use with your patients. again, all these resources will be shared with you in the next few days after this webinar is completed. I'm sorry, after this LC session is completed. So making sure that you are going to receive all these and you can print them and you can help your patients on how they can visualize portion sizes. Next slide, please. Lastly, we are going to talk about how we can choose wisely if someone is talking about a latte made with whole milk, we can shift it to fat-free milk. Or if someone is having a regular drink, this person can either try water flavor with fruit or vegetables. If many people drink sweetened lemon iced tea, we can use sparkling water with natural lemon flavor, etc. So there are some options that we can show our patients and what they need to do. I am addicted to cookies, so I see the snacks with added salad sugars. So what I have to do is just to replace it and have some snacks without added salad sugars, specifically some almonds or peanuts or any of these meals or food that can substitute what I'm having. And we tend to do it. Everybody likes desserts or everybody likes an extra portion of food, but we need to keep in mind and we need to teach our patients that you can also, there are some alternatives when we are having any of these controversies and see and show them that there are some healthy alternatives when we are talking about any of these desserts or cookies or things that we eat every day. Next slide. So I'm going to stop here. If you have any questions, I will be more than happy to answer any questions. In the meantime, you can go to our website, get all the information about upcoming resources. Please do not forget to complete the survey after this activity. And Fide, I'm going to stop for a moment and see whether there is any questions.
Sure, yeah. Just a reminder to everybody that you can also raise your hand if you would like to ask any questions or provide any feedback or an example of any promising practices that you may be implementing in your health center. And you can also do that in the chat. Yes, that is correct, Francis. Dr. Neon, Francis is saying that there is a lot of children with diabetes.
Yes, unfortunately, that is correct. And one of the concerns is not type 1 diabetes, because this is considered autoimmune. As in type 1, there is a destruction of the pancreas. This is considered an autoimmune disease. The main concern for clinicians at this point is that there are children developing type 2 diabetes, which in the past, it was considered an adult onset type of diabetes. Now we are seeing more children with type 2 diabetes. And this is because our kids are not eating well. We are having kids eating a lot of junk food and high calorie meals, and they are not exercising enough. TV, video games, and all these are some of the culprits that I see. But Francis is totally right.
We have a question, is that related to dietary intake? And also we have another question by Janice. For people with diabetes, is it It is hard to control sugar. What will be the best alternative for sugar if they cannot avoid eating a little?
You know, that's a great question. And the reason is that people believe or tend to believe that because you are diagnosed with diabetes, you have to eliminate sugars from your diet. And even though you need to reduce the number of calories coming from sugar, you don't have to, because as we said in the very beginning, sugar or glucose or sugar in general, I mean, this is the fuel that our cells need to produce energy. So what we have to do is reduce the amount, you know, we don't have to eliminate this. Make sure that our patients are exercising and make sure that they are eating more complex carbohydrates. We are talking about a starch and everything that is whole, like the whole wheat, you know, but anything that is simple sugars, specifically that sugar that we have to sweeten the coffee or milk or what, or any drink that we're having, those are the type of sugars that we need to avoid.
Mhm. We also have a comment. Let's
You
see.
know, that's a great question from David or David. Babies are born with diabetes and family without diabetic history. We've been talking, or we discussed briefly gestational diabetes, mothers who develop diabetes. What is happening with these babies is that they usually are overweight. So they are over 8 pounds and they do not have diabetes, but they are more likely to develop diabetes when they get older. So it's not that they develop diabetes, you know, when they are born, but they can develop diabetes, you know, when they get older if the mother had gestational diabetes. Is honey a good alternative? Excellent question. Honey has plenty of sugar. You know, I do not recommend, you know, and it will depend on how controlled or uncontrolled your diabetes is. I mean, if you are exercising, if you are having unhealthy food, you can have a little bit of honey. But if you cannot control your diabetes, if your numbers are high, I prefer, you know, to recommend my patient not to have honey.
Mhm.
Yeah, it's same with the smoothies. You know, I mean, just when we talk to our patient, let's keep this in mind. We are talking about small, medium, and large drinks. You know, and once in a while you can have a smoothie. I mean, because you have diabetes, it doesn't mean that you don't have to eat sugar. It means that you have to make sure that you control and you look for alternatives. You know, and juices, any natural juices are good if the patient has uncontrolled diabetes or the numbers are not good. But if the numbers are good, if this is a good patient following the recommendations, once in a while a person can have a smoothie. But it's not that I'm going to have a smoothie every day. Even if I don't have diabetes, I will be more likely to develop diabetes if I increase the number or the amount of sugar that I have every day.
Mhm. And then we have one last question. Mother has type 1, babies are normal birth weight, no family history of diabetes elsewhere. Our kids are at risk.
Yeah, I mean, it's mentioned, or we mentioned some of the non-modifiable factors, and family history is something that we cannot modify or we cannot change. I could say that the person, in this case, the kid will be at risk, you know, but it will depend on whether or not, more than family history, I believe that it's important to mention that we learn to eat from our family or close relatives. So the family history is not only related to the whether or not you have the condition, but how or what you eat. I always give this example. I am from Latin America. We have a lot of food rich in carbohydrates. We learn from our family to eat beans, rice, desserts, and all kind of foods that are rich in carbohydrates. So more than the genetic piece is how we teach our people, our children how to eat. So this is a process that starts from they are newborn, the amount of food that they eat, the type of food that they eat. So when you get when you are an adult, you are not dealing with that family history that you have. But to answer the question specifically, the type 1 diabetes, there is, since this is a non-modifiable factor, this child or kid is more likely to develop diabetes in the future. Yet, with the vet, we are going to discuss labels during our next session. So that is a great point. Teach our patients how to read these labels. And if you have any example, if you can bring some label for our next session, that would be great. We are going to have some of those, and we are going to make sure that we share that information. And thank you, Yvette. You said that we can download the UCA application. It's an excellent guide when food shopping. Thank you so much for that information. So I don't see any additional questions. Thank you so much for attending this first session. Again, please help us to improve our activities. There is an evaluation survey after this session is over. So please complete the post-evaluation survey. Next slide. In the meantime, if you have any questions, any concerns, you would like to share any of the stories, you would like to talk to us, and if you have any promising practice that you would like to share next week with us, let me know. That's my email address, jose.leon@namgt.com. You can also contact FIDE, fide@namgt.com, and we will be very happy to hear from all of you. So thank you so much and have a great afternoon.
Thank you all. See you all next time.